Thank you, Dr. Anil Kumar sir. Good evening, everybody. Sir, is it visible and am I audible? Okay, okay. So once again, good evening, everybody. So my topic for today's presentation is harnessing Ayurveda for successful dermatological treatments, where I will be discussing regarding two case studies, where the first case is mainly regarding sometimes we really feel some cases as very simple, yet the proper line of treatment is very important to cure the diseases. So though the case felt very simple, but still how did it took so long for the patient to get a proper treatment would be the gist of the first case. And in the second case, how the role of Rutu in treatment of a disease completely, I mean cure of a disease completely was helpful will be discussed. So beginning with the first case, a 34 years female patient visited the OPD with the chief complaint of severe pain with rough, fissured, and cracked heels associated with blackish discoloration, moderate itching, and unable to walk due to pain. And all the symptoms are seen since last 10 years and worsened since a month. So this was her major complaint. And history of the present illness, the patient was said to be apparently healthy before 10 years, and gradually she started feeling cracked heels, blackish discoloration over the heels with severe pain, itching, and bleeding on itching. Itching and pain aggravates on eating spicy foods, brinjal, potatoes, on using detergents at evening and night times. She consulted many allopathic doctors for the same, but her complaints continued to worsen and medications were stopped before 6 months. From past a month, her complaint got aggravated, making her unable to walk, which resulted in a lot of emotional distress. So patient came seeking Ayurvedic management. So here we could see in the picture, this was the condition when patient visited our OPD. So we can see a lot of fissures and cracks at her heels and also with respect to her left palm. Personal history, her appetite was reduced, bowel was constipated, sleep was both reduced and disturbed due to pain. Micturition was 6 to 8 times a day with normal color. And with respect to habits, she used to have coffee 3 cups a day. And medical history, there was nothing relevant found, and there was also no history of hypertension or diabetes mellitus. Patient was on allopathic medication for the above complaints, as I said before, but the details were not known to the patient. Patient was basically I think she had studied only till third or fourth standard, so she did not actually had the history, whatever the treatments was taken or whatever the medicines were prescribed. Next, moving on to the general examination, there was nothing specific found related to the case. And with respect to her vitals, BP was 110 by 70 mmHg, pulse rate 74 per minute, and respiratory rate 16 per minute. Clinical findings on skin examination at the soles of both the feet, there was no swelling or local raise of temperature seen. Flakes were seen associated with positive auspice sign. Blood pressure, pulse, and other systemic examination findings were normal. Laboratory investigations showed elevated ESR levels, and rest of her CBC counts were within the normal range. Diagnosis, based on the symptoms and clinical findings, the case was diagnosed as Vipadika, as Panipada sputana was associated with Tivra Vedana, which is the Lakshana with respect to Vipadika. So generally, whenever we see a case of Vipadika, as I was saying before, we feel it as a very simple case where the Bahya and Abhyantara Snehana would definitely give a lot of improvement in the case. And there are a lot of case studies and the things which where mainly the Basti has taken as intervention in case of Vipadika. But in this condition, there was slight alteration in the treatment or the management. So the treatment here prescribed was, or the treatment plan was Virechana followed by Shamana. So why was it not Basti and why was it Virechana will be discussed in the following slides. So from day 1 to day 3, that is in the beginning of 3 days, Sarvanga Udvartana with Kola Kulatadi Churna followed by Bashpasveda was prescribed, along with Sutta Shekara Rasa, 2 tablets 1 hour before food was prescribed. Then from day 4, Arohana Krama Snehapana was started with Mahatiktaka Grita. Snehapana was done for 4 days with 30 ml, 70 ml, 100 and 120 ml respectively. From day 8 to 10, that is where Sarvanga Abhyanga followed by Bashpasveda was done, and for Sarvanga Abhyanga, Nalpamaradi Taila was used. And on day 11, Virechana was administered with 80 grams of Trivrit Lehya and 150 ml of Draksha Kashaya. Totally, there were 18 Vegas by the end of the day, and patient was comfortable. Before moving on to the Virechana part, one more thing I want to say here as the practical part is, during Snehapana, there was slight increase with respect to complaints of the patient, like her itching was increasing, pain she was facing was increasing, because of which she was confused whether to continue the treatment or not, because patient was basically from a lower socioeconomic condition. And as it was the treatment given in a private hospital, which actually costed much more for them. So she was actually in a dilemma whether to continue the treatment or not by second day of Snehapana. But somehow we were able to convince the patient that on the day of Virechana or after Virechana, she would have much more relief, and that is how she continued with the treatment. Practically, in my experience, this is what I would like to highlight, that during Snehapana, most of the patients will not be willing to continue with the treatment. Main thing is, especially with the dermatological conditions, most of the times they get aggravated during Snehapana and they get subsided immediately after Shodhana. So it will be our duty to completely or to continuously increase or to continuously keep motivating patient for completing the treatment. So totally there were 18 Vegas by the end of the day, and patient was quite comfortable even on the day of Virechana, like after stoppage. Patient was very much comfortable and she actually had a very good sleep. Even patient party told us in the morning that she was, after many long years, she had slept peacefully for the whole night without any pain. So the next day, patient was discharged with 5 days of Samsarjana Karma, as there was Madhyama Shuddhi. And she was also advised with the Shamanaushadhi and the Patya Ahara. Patya Ahara, which was followed during Snehapana, was after Sneha Jirna, Shali Peya in the afternoon, and Krishara or Khicha in the night was given. And strictly only these two things was advised for the patients. And as she had suffered from so many long years and pain was so severe, even patient was very strictly following the same diet. Nothing else was given to her. Then during Samsarjana, that is on day 12, patient was given with Shali Peya. Then on day 13, it is Vilepi. Day 14, Akrita Mudgayusha. Day 15, Krita Mudgayusha. Day 16, again, Krita Mudgayusha was continued. And from day 17, she was asked to resume back slowly to the normal diet with certain restrictions with respect to her food. Then from day 17, when after she resumed back to her normal diet, some Shamanaushadhis were also prescribed from day 17 to day 32. And it was Aragwadadi Kashaya, 5 tablespoons morning and evening, 1 hour before food, along with 100 ml of warm water. Gandhaka Rasayana, 2 tablets along with Aragwadadi Kashaya. Gandharva Hastadi Eranda Taila, 2 tablespoons along with 50 ml of warm milk at bedtime. Then Mahatiktaka Lepa, external application. So these were the Shamanaushadis that was advised for the patient. Along with the Shamanaushadi, the other advices, as I told before, the following of Pathya was very strict for her, even during the treatment and after the treatment. After the treatment, after resuming back to normal diet, she was strictly advised to avoid oil fried food, refined flour, refined sugar, or any other preparations which would hinder the healing and which would aggravate her complaints. So she was also advised to wear cotton socks and gloves regularly and to avoid contact of foot and palms with soil, dust, and long time contact with water to promote healing. Observation, before treatment, there was severe Panipada sputana with dry, scaly heels and severe pain hindering walking, and there was moderate itching too, as we have already seen. And after Shodhana, this is immediately the next day of Shodhana, pain was slightly reduced, so the patient could walk, and also mild reduction in dryness and itching was also seen. So this is where patient was really happy with the therapy, because she came in a condition where she was completely unable to walk and she was literally crying on the day of OPD visit. But by the time she went back, she was able to walk. And there was also mild reduction in her dryness and itching. During the first follow-up, that is on day 32, there was complete absence of pain, itching, and fissures and cracks were seen healing well. So there was, compared to the first visit, there was healing of fissures and cracks. And during the second follow-up, that is day 48, there was complete absence of pain and itching as it was in the first follow-up, and cracks were completely healed. So just for the comparison, this is how the foot and her palm looked when she came to the OPD for the first time. And here, this is the first follow-up photo where we can see discoloration is slightly reduced and the fissures and cracks are healing. And this is during the second follow-up where we can see completely her fissures and cracks are healed. And even with respect to her hand, it is completely healed. And only at the borders of the heels, there is still some amount of discoloration, which took a little more longer time to completely resume back. Results, the selected line of treatment was proved to be fruitful as patient was comfortable with mild reduction of pain and burning sensation by the next day after Virechana as a result of Samyak Shodhana. After Samsarchana Karma and Shamanaushadi during the first follow-up and the second follow-up, we have already seen the results. Discussion, as this is a chronic case, Shodhana followed by Shamana was opted as the line of treatment, and here Shodhana planned was Virechana. The reason why we selected Virechana was, though this is a Vata Pradhana Kushtha, Pitta and Kapha also needs to be treated, as without the involvement of Pitta, Kushta cannot occur, and itching indicates the involvement of Kapha dosha too. And also patient visited us during the mid of the October, so which was Sharad Rutu. There was all Rutu Lakshanas of Sharad Rutu were seen, and that is the reason where we actually planned for Virechana rather than going to Basti. So Virechana, which is Kapha and Pittahara and Vatanulomaka, was selected as the intervention. And Udvartana was done with Kola Kulatadi Churna, as it is Kafahara and Kandugna. Though in this case, Kandu, that is itching with respect to her palm and her feet, was there was no specific improvement related to that, but still as a part of Rukshana, we have done Udvartana with Kola Kulatadi Churna. Then Sutta Shekara Rasa is considered for Deepana Pachana, as it is Mandagnihara. And considering the potent action of Maha Tiktakagrita in Kushta along with its Pittahara and Kandugna action, it was opted for Snehapana. Nalpamaraditaila practically acts very best in case of Kushta, especially with discolorations, that is dark discolorations. That is why it was selected for Sarvanga Abhyanga. And Trivrit Lehya, where Trivrit is a best Sukha, Virechaka, and Draksha is one among Virechanopagagana. That is why Trivrit Lehya along with Draksha Kashaya was selected as Virechana Dravya. And for Shaman Aushadhi, Aragvadadi Kashaya, which is again Kushtagna and Vrana Shodhana, which helped for healing the cracks and fissures, was prescribed. Then Gandhaka Rasayana, which is also Kushtagna, and as the name itself says, it also acts as Rasayana after Shodhana. Gandharvahastadi Eranda Taila, where Eranda is best Vatahara and Taila helps to remove the Rukshata along with Vatanulomana. That is why it was also prescribed at bedtime along with Kshira. Mahatiktaka Lepam is a proprietary medicine of Kotekal Pharmacy, which has Mahatiktaka Grita with purified Tutta and Tankana as its composition. Tankana, which has Vrananashana and Vata, and also it is Vatahara, and Tutta is Tvachya and Vranadosha Nashaka. So this is why for external application Mahatiktaka Lepam was opted. Conclusion, the present case study concludes that Vipadika has been effectively treated with Virechana followed by Shamanaushadhi in spite of its chronicity and severity. So, in spite of its 10 years of chronicity and such severity, this line of treatment could give a successful result. So, this is about the first case. So, let us look into the next case. Case 2, where a 19-year-old female patient visited the OPD with the chief complaint, brownish gray discoloration or discolored skin lesions on both the palms associated with itching and peeling of dried top layers of skin and scratching. Also associated with dryness and roughness over the skin lesions. All the symptoms were seen since last 3 months. So it was a very acute condition where all the symptoms were seen only since 3 months. And itching was also complained at the bilateral flank region, scalp and lower back with no discoloration. So in these regions, there was only itching was the complaint. There was no discoloration or no skin change observed. And these complaints were since 1 month. History of present illness, the patient was said to be apparently healthy before 3 months. Gradually, she started feeling itchy with dry brownish gray discolored lesions over both the palms associated with dry scales on scratching. Gradually, itching started spreading to other parts of the body like bilateral flanks, scalp and lower back region without any discolorations associated. And itching and scaly discharge aggravated on eating spicy foods, brinjal, potatoes, even use of masha at evening times and in the night times. She consulted allopathic doctors for the treatment of above complaints and medication was also taken. But because there was no improvement, she has discontinued the medication and she came seeking Ayurvedic management. So this is how the palm of the patient looked when she visited our OPD. We can see the discoloration along with dryness. Personal history, appetite was slightly reduced and bowel was regular. Sleep was sound, micturition 6 to 8 times per day, habits nothing specific. Medical history, no relevant history found, and patient was on allopathic medications, but still the details of the treatment or the prescription was not known to the patient. General examination, nothing specific. Then vitals, BP was 110 by 70 mmHg, pulse rate 72 per minute, and respiratory rate 16 cycles per minute. Clinical findings on skin examination at the palms, scalp, lower back, and flank region. There was no swelling or local raise of temperature seen. Brownish gray discoloration was seen on both the palms as we could witness in the picture. Then thick skin lesions with scaly discharge were seen with candle grease sign negative and also auspit sign negative. It is by mistake, it has been positive here, but both these signs were negative in this condition. Powdery discharge on scratching was seen on the scalp. I had tried taking photos of this, but it was not clear in the photo, so that is why I could not take photo of her scalp. But when we scratched, there was powdery discharge seen even in her scalp. No discoloration on scalp, lower back or flanks. So, and the skin at lower back and flanks looked very much normal externally, but her only complaints was itching present there. Blood pressure, pulse, and other systemic examination findings were within the normal range, and laboratory investigation showed decreased HB levels. It was only 8.9 gram per DL that was seen, and also elevated ESR levels. Diagnosis: based on the symptoms and clinical findings, the case was diagnosed as Kitiba Kushta with Shyava, Kinakara Sparsha, and Parusha associated with Thandu. Treatment prescribed. So here the treatment plan was Vamana followed by Shamana. So though it was a very acute condition, still the treatment plan was Vamana, and we'll be discussing in the further slides why Vamana was chosen in this case. And before Vamana, for Deepana Pachanartha, for 7 days, Chitrakadivati and Pipalyasava. Chitrakadivati in the dose of 1 tablet before food 3 times a day, and Pipalyasava 2 tablespoons after food 3 times a day was being given for 7 days. And from day 8 to day 12, that is 5 days of Arohana Krama Snehapana was done with Dadimadhyagrita. And day 13, Sarvanga Abhyanga followed by Bashpasveda was done. And for Sarvanga Abhyanga, Eladi Taila was opted. Along with the therapy, Kapha Utkleshakara Ahara, that is during Vishramakala, that is after Snehapana on the day of Abhyanga and Bashpasveda for Kapha Utkleshana. Dadi Shalyana, that is curd rice, and Ikshurasa around a liter, Masha Payasa around 200 ml, Tila Laddu 7 to 8 Tila Laddus, and other Madhura Guru Ahara. Under this, actually, she had consumed around half a kg of milk peda, and these were given for the patient for Kapha Utkleshana. The next day, Vamana was administered after Purvakarma, that is after Abhyanga and Svedana, early morning in Kafakala, that is by 5 a.m. Abhyanga and Svedana were done. And by 6:30, she was made to drink Kshira, that is Akantapana was made with Kshira, followed by Vamana Aushadhi. So for Vamana Yoga, 8 gram of Madanaphala Pippali Churna, 8 gram of Yashtimadu Churna, 4 gram of Vacha Churna, 2 grams of Saindava Lavana was mixed well with 50 gram of Madhu. So this was the Vamana Yoga used in this condition. And with respect to number of Vegas, after intake of this Kshira, like within 20 minutes, there was starting up of the Vegas, and 2 Vegas were seen initially, where Kshira Utsarga along with Kapha and milk was seen. And by 6:55 a.m., Yashtimadu Jala, that is after Kshira, we had given her Yashtimadu Jala up to 2 liters. After which she had the third Vega, where Kapha along with Yashtimadu Jala and milk was seen in the Vamaka, in the vomitus. Then by 7:15, Saindava Jala around 2 liters was given, which had 4th Vega, that is Kapha, along with Yashtimadu Jala and Saindava Jala, followed by 5th Vega, Kapha and Aushada, along with Yashtimadu Jala and Saindava Jala was seen. Then by 7:30 a.m., that is followed by Saindava Jala. So Koshna Jala up to 600 ml was given, and the 6th and the last Vega, which was with Pitta and Aushada along with Yashtimadu Jala and Saindava Jala was seen. So this is how the entire procedure of Vamana was carried out for the patient. Vitals of the patient were continuously monitored during the entire procedure, that is before starting up with Vamana and after her Vegas also. Vamana Vega started spontaneously after 20 minutes. So there was no tickling done in this condition, or there was no inducing of Vamana done in this condition. After 20 minutes, it was spontaneously started. Total number of Vegas were 6, and Pittanta Lakshanas were noted in this condition. Patient was asked to wash her hand, feet, and mouth with cold water and relax for few minutes after Vamana. After noting the vitals, which were within the normal range, she was administered with Pairechaniga Dhumapana. Patient was comfortable and was advised not to have anything till she feels hunger. And Samsarjana Krama. So on day 14, that is on the day of Vamana, she had nothing in the morning and afternoon, as she was not hungry. And at night, she was given with Shali Manda. And on day 15, Shali Peya was given. Day 16, Vilepi. Day 17, Akrita Mudgayusha. Day 18, Krita Mudgayusha. Day 19, Krita Mudgayusha in the morning and Khitcha in the afternoon and night. And day 20, Khitcha in the morning and afternoon and night. It was soft rice plus dal. Shamana and Rasayana Aushadhi after Shodhana. So this was given after she resumed back to her normal diet from day 21 to day 78, where capsule Mahatiktaka Grita was opted. 2 capsules in the morning before food. So here, instead of Mahatiktaka Grita as such, capsules were opted. As patient was unable to bear the smell of Mahatiktaka Grita, she was not able to have it. So that is why we have selected capsules. And Arogyavardhini Vati, 1 tablet before food. Gandhaka Rasayana, 1 tablet after food 3 times. Eladi Kerataila. This was advised for Abhyanga for the entire body, including her palms, 15 minutes before bath for her entire body, and 777 oil after bath on the affected areas. Along with this, the other advices given were after resuming back to normal diet, patient was advised to avoid the use of curd, black gram, spicy foods, brinjal, potatoes, oil fried food, refined flour, jaggery, and refined sugar used foods, which could again vitiate the doshas, leading to aggravation of the conditions. So these were the restrictions that were specifically advised. Observation before treatment, we have already seen what was her complaints and how does the palm looked. After treatment, that is the first follow-up, which was 1 month after her discharge, there was no itching, dryness was reduced, and the lesions have started to heal well. And after the treatment, during her second treatment, which was almost 2 months after her Vamana, skin lesions were completely healed and there was no dryness and itching seen. So this image shows the progression in the treatment. So this is how her palm looked before the treatment when she visited first time in our OPD. And this is the palm, how is it looking after the first follow-up or during the first follow-up, and this is how her palms looked during the second follow-up. So we can see the lesions are completely healed and even there is no discoloration seen on her palms. And even the itching which she was complained at the other parts of the body like her scalp, flanks and the lower back region was also completely absent. Results patient was completely cured from Kitiba Kushta with no recurrence with the follow-up till 1 year. So patient, even after complete absence of her complaints, she was asked to come for the follow-up every 3 months and follow-up was done till 1 year to ensure that there is no recurrence of the complaints and normal color and texture of the palms were restored. Moving on to the discussion part, the present case was an acute condition with the history of onset. That is, there was only 3 months history. Patient visited the OPD during mid-March in Chaitra Masa, which is the beginning of Vasanta Rutu, and her complaints of increased itching indicates the dominance of Kapha dosha, which also complements Rutu Anusara dosha avastha in Vasanta Rutu. So that is the reason why we opted the Vamana Karma as Vasanta Rutu. As we know, it is regarded as Sadharana Rutu for Kapha Shodhana. So Vamana was selected as the major line of treatment here. For Deepana Pachanartha, Chitrakadivati and Pipalyasava were used as both of them does Amapachana and Agni Deepana. Dadimadhyagrita was selected for Snehapana as it is Vata and Kafahara, and compared to any other Grita, intake of Dadimadhyagrita is comparatively easier. So even taking care regarding the palatability of the patients, there was no other bitter gritas were selected because bitter gritas are better they have better kafahara action, but still considering the palatability of patient, we have selected Dadi Madhya Grita. As patient complained of moderate headache. This was actually seen during her Snehapana. The third day of Snehapana, patient complained regarding moderate headache. That was managed by application of Rasna Churna Lepa over forehead, as it is Ushna and Shitahara, Vata and Vedana Shamaka. So Rasna has these properties. That is why Rasna Churna Lepa was applied on her forehead. Rasna Churna was just mixed with warm water and the Lepa was applied. And this application was repeated for 2 to 3 times in a day till her Snehapana completed. That is third, fourth, and fifth day, Lepa was continued. And she was also given additionally with Shunti Jala around 20 to 30 ml to reduce her headache, as Shunti Jala helps for Deepana Pachana of the intaken Sneha, and also Shunti acts as Vedana Stapaka. Then Eladi Kerataila was selected for Abhyanga, as it is Vata Kafahara, Kandugna and Varna Prasadana, so which helps for restoring her normal skin complexion. Then Madanaphala, which is regarded as Shrestha for Vamana, hence Madanaphala Yoga with other Vamanopaga Dravyas like Yashtimadu, Vacha, Saindava and Madhu were used for the therapy. There was Pravarashuddhi with Samyak Shodhana Lakshanas, and that is why 7 days of Peyadi Samsarjana Krama was advised for the patient. After resuming back to her normal diet, the above explained restrictions of Kafakara Ahara, she was advised she was advised with Rasayana Dravya along with the restrictions, which also acted as Shamana Aushadhis. Like I was saying before, we selected capsule Mahatiktaka Grita rather than giving Mahatiktaka Grita as such. And Mahatiktaka Grita, as we know, it is Kandugna and Kushtagna. And the capsule which we had selected also had more amount of Amalaki in that. So Amalaki is also beneficial as Rasayana after Shodhana. That is the reason we had selected Mahatiktaka Grita capsules. Arogyavardhini Vati is Tridosha Shamaka, Kushtagna and Pathya, and it also acts as Rasayana. That is why Arogyavardhini Vati was prescribed. Gandhaka Rasayana is Vata Shamaka, Kandugna and Kushtagna. Eladi Kerataila is again Vata Kafahara, Kandugna, Varna Prasadana. So that is why it was continued even after the Shodhana Karma for regular Abhyanga, because she also had itching on her other body parts. So that is why Eladi Kerataila was specifically opted here. Then 777 oil, which is a proprietary medicine by Dr. GRK's Research and Pharmaceuticals Private Limited, which is basically a Siddha medicine which has Kutaja and Narikela Taila as its key ingredients. So this is again widely used in clinical practice of Ayurveda, especially in dermatological conditions which are associated with itching and scaling. So the same oil was used even in this condition. Conclusion. So this is a case study with the novel understanding which concludes the theoretical concept of secondary prevention in Ayurveda. As we all know, there are mainly 4 levels of prevention: primordial, primary, secondary and tertiary. Primordial, where before even the emergence of risk factors, we go for preventive measures. Primary, where after the emergence of risk factors, we follow the preventive measures. Secondary, where there is exposure to the risk factor and the disease has occurred, still we intervene with the proper treatment to prevent further complications. That is the secondary prevention. And tertiary prevention, where the disease has already occurred and even the complication are being caused, but still we intervene with the help of rehabilitation. So these are different levels of prevention. So this theoretical concept of secondary prevention was applied here, which means treating the disease in its early stage to prevent its chronicity and further complications with the right line of treatment can not only cure the disease but also prevents the recurrence and restores the health back to the normalcy. That is why the follow-up was done up to 1 year so that there was no recurrence of the complaints. Further, screening such cases and considering them for clinical trials in large groups are to be conducted at multicentric levels, which can provide evidence for standardizing the treatment procedure. So these are the line of treatments which were particularly selected for this condition. Of course, that doesn't mean we will select only this line of treatment for all Gitiba Kushta or for all Vipadika cases. So for such conclusions, again, large clinical trials are to be conducted. So this is about the case studies. And here is the link. Both of these studies are being published, and here is the link for the article, which has all the references for this. So if you are interested, you can check there. I'll also share this link with Hetal ma'am. So it will be shared in the group. And if anybody is interested, then you can look into the article. Thank you. Meanwhile, I would also like to extend my heartfelt thanks to Hetal ma'am for providing me this opportunity to share my views regarding these cases, and I hope it is benefited for the participants. Thank you again.
Hello, ma'am. Hello. Hello, ma'am. Uh, Ma'am, thank you for the very nice session. Hello.
Yeah, you are audible. Please
Yeah, yeah.
continue.
Ma'am, I just wanted to ask for Adadikeram. Like, you can elaborate on that, like, and which all other conditions we can use it, like with some rash or
Generally,
discoloration. Hmm.
yeah. Generally, in my practice, I use Eladi for a lot of conditions, especially rather than Tilataila. What I have felt is Kerataila, that is coconut based oils, have better effect, especially with respect to resuming back the skin complexion, normal color and complexion. Like it can be any kind of skin marks. It can be marks because of acne, or it can be even the striae marks that are seen during pregnancy. So in all those conditions, regular abhyanga, which is said as a part of dinacharya, if it is being followed with Eladi Kerataila, there is lot of good results seen. So not only in this condition, as I told you, for a lot of conditions and even as a part of preventive care, I mostly use Eladi Kerataila and there are very good results.
Okay, ma'am. Thank you.
Hello, ma'am. Huh. Ma'am, it was a very nice session. I wanted to ask how to decide where we have to use Nalpamaradi Telam and where we have to use Eladi Telam, because both you said we can use for blackish discoloration. So, how to select?
Yeah, thank you for the question. So, see, Eladi Kera, as I have mentioned, it is mainly Vata and Kapahara. So, the conditions where mainly you see there is lot of dryness and also there is lot of Kaphaja symptoms like itching is being seen. There you can mainly opt for Eladi Taila or Eladi Kera Taila. And with respect to Nalpamaradi, its main ingredient is Panchavalkala, which is Pittahara. So, if it is associated burning sensation and also the discoloration, then you can go for Nalpamaradi Taila, or you feel as a part of preventive purpose, you want to use it for regular Abhyanga. So if the individual is of Pitta Pradhana Prakriti, or if it is in Sharad Rutu, which is dominated by Pitta, go for Nalpamaradi Taila. Or in the other conditions where Vata and Kapha is being dominated, there is pain associated with discoloration or itching associated with discoloration, you can mainly choose Eladikeratina.
जी मैम। और कोई डाउट
Ma'am,
है?
or this Mahatikta capsules, like they were given for how long later on? As Shaman Chikitsa.
Sorry, can you please repeat?
Mahatikta capsules were given for how long? Like for how much duration later on? Like
It
in
was
Shaman
given for
Chikitsa.
2 months. 2 months.
Okay. And the dose, like it was?
It was 2 capsules early in the morning, empty stomach.
Okay. Thank you.
Ma'am, why did you select Mahatikta drip capsules and why not drip directly?
Yeah, I think I had already answered this question
Oh,
in the
sorry.
discussion part, but it's okay. I can repeat it for you. As I told you, see, patient is of 19 years and she was not ready to have Tiktaka Gritas. Even then, we were able to somehow console her to continue Snehapana with Dadimadhya Grita. And after Snehapana, we really have that hatredness towards Grita itself. So obviously convincing her to take Mahatiktaka Grita was not possible. That is why I selected the capsules of Mahatiktaka Grita. And one more reason, as I told, these Mahatiktaka Grita capsules were also containing Amalaki. So Amalaki after Shodhana would also give the Rasayana effect, which is beneficial, especially for the skin. And that is the reason I chose the capsule of Mahatiktaka Grita.
Thank you, ma'am. Ma'am, one thing also I wanted to ask. In first case,
Yes.
you used a Nalpamaradi tail, which is Pitta Shamak, as you said, and one side you used Erand tail also, Gandharva Hastadi tail.
Yes.
So it is Erand tail is Ushna Virya, no? So
Yeah,
why did you
but
select that?
yeah, and see, Nalpamaradi Taila is being used externally for Abhyanga, and Erand Gandharvahastadi Taila was used in Vipadika condition for internally, as Nehana was needed, and also to reduce the Rukshata to help the healing of the cracks, it was used internally.
Okay, ma'am. Okay, thank you.
मैम एक क्वेश्चन है इसमें चैट बॉक्स में।
Hanji, I think they have asked male patient after having non-veg started itching and gets circular red color rashes. What can be done? See, I would say that if you can give me the a proper history, male patient of what age and since when he is having this and how does exactly the rashes looks, then only it will be possible for me to comment anything on this.
जी मैम।
Ma'am, hello, ma'am.
Yes, yes.
Ma'am, I wanted to ask, like pimples and acne are Vat Kapha Dushti in a Rakta. So, how should we proceed? We should do Vat Kapha Shamak Chikitsa or Rakta Shamak Chikitsa because both are opposite. So, how should we proceed for them? What do you
See,
do?
even with respect to acne, in my practice, like every patient of acne will be different. Like few individuals will have dominated pitta with respect to their acne. Like there will be more of redness seen. There will be more of pus formation seen. Where you should actually go for pitta shamaka and rakta prasadaka line of treatment. And if the acne are like very small, they are like pointed things, and if there is dryness in spite of that acne is been increased, then you can go for vata shamaka line of treatment. Like internally you can go for rakta prasadana, and external applications can be planned with respect to that.
Thank you, ma'am. Ma'am, what can be applied externally for that pimples, blackish marks, or yes?
Yeah, that is what. In my practice, I used to give the combination of churnas. So if it is pitta dominated, like there is lot of oiliness seen in the skin, and also there is a lot of redness seen, then generally Yashti Madhu was my choice. So Yashti Madhu along with Takra, and added with a slight amount of Nimba, and even Manjishta was generally my combination I was doing. And if at all it is Vata dominated, where there is small acne and it is again associated with dryness, then in that condition, along with this Rakta Prasadaka or the um, acne suppressing pack, whatever I have prescribed, like Yashti Madhu and all. During pack, it is a slight amount of Grita or Kerataila that was mixed along with the pack and it was used. But it should not be kept for a longer period of time, like only for 5 to 10 minutes the pack was applied and removed with warm water. So that actually had very good results in such kind of acne.
जी
Ma'am, what can uh, just yes. So what can be applied for dark circles and what should be the line of treatment externally and internally?
Yeah, see, dark circles, first of all, you're supposed to know why there is dark circle. You know, whether it is because there is lowered HB, then you are supposed to treat that. If there is disturbed sleep, then we are supposed to go with that. If it is because of excessive chinta, then we are supposed to go with that. So the internal things definitely matter based on the cause of the dark circle. Externally, generally, we used to do mild netra abhyanga, for which we were using either plain coconut oil or plain almond oil, badam rogan, what we generally say, that was used. And the almonds were soaked in milk and they were made into fine paste along with milk, and we used to apply it over the dark circles. And during that, because it should not be dried over that, we used to apply the Taruni Arka, that is the rose water. So these were things generally we were like I was using in my practice.
Okay, thank you, ma'am.
Yeah, somebody has asked in the comment box, ma'am, please share your contact number. Okay, that again, I'll ask Hetal ma'am to share my contact number in the group.
मैम चैट बॉक्स में ही एक दो क्वेश्चंस हैं.
Yeah, I'm seeing the same thing. Can Shita Pitta and Udard eradicated completely? Please suggest the treatment. Yes, in my practice, cases of Udarda I have not much seen, but Shita Pitta definitely it can be completely eradicated, or at least 99% of the times it can be completely cured unless and until patient indulges with very high nidana. Again, there can be reoccurrence. Otherwise, it can be completely cured. Generally, the line of treatment which I follow in Shita Pitta is If it is other than Sharad Ritu, basically I do not post the patient for Shodhana unless and until it is Sadharana Ritu, that is the Shodhana Ritu. If it is other than Shodhana Ritu, then Shavana line of treatment will be followed, and we'll wait. If it gets subsided like that, then it is well and good. If not, then Virechana will be the line of treatment, which will be done in Sharad Ritu only. And Virechana is generally followed with the Shamana Aushadhis, which mainly includes Haridra Kanda, Kushmanda Rasayana, and Gandhaka Rasayana. So, and external application, Eladi Kerataila or Nalpamaradi Kerataila. So, these things would completely cure Shita Pitta. And along with this, as I told, Nidana Parivarjana is very much important. Generally, use of chilies aggravates Shita Pitta, and use of any other sour preparations like golgappas or even excessive usage of chicken aggravates Shita Pitta. So if Nidana Parivarjana along with this line of treatment has been followed correctly, then there will be complete cure from Shita Pitta. Post-acne Shyava Varna, please suggest. So post-acne Shyava Varna, as I was saying, go for application of keratailas. It can be either Eladi kerataila or Nalpamaradi kerataila. And because it is a condition of acne, do not apply it overnight or for longer hours. So please underline, do not apply it for longer hours. Just apply it 10 minutes before you take bath, and you can wash it. This will gradually remove how much ever dark spot it is. It will be gradually removed. And still, if you feel it is not being removed, you can add rice flour, you can add lodra powder, manjishta powder, and mix it with either tomato juice or potato juice and use it like a mild scrub. Do not pressurize, use it like a mild scrub over your skin for 1 to 2 minutes, not more than that. Okay, if you do not want to use it like a mild scrub, you can also use it like a face pack, a thick layered face pack, which you can leave it for 10 minutes. And whenever you apply face pack, please apply it so thick that within 10 minutes, it should not be completely dried. It should be still wet. At least there must be 50% of wetness still there in the skin, and you can wash it off with normal water. So that will definitely remove any sort of acne pock marks.
नमस्कार मैम। मैम मेलास्मा के केस में क्या दे सकते हैं स्किन के उसमें?
For melasma, before coming here, actually, I had certain things that was followed in this case. We had very good results with Panchavalkala Churna scrubbing. Panchavalkala Churna scrubbing followed by Jalavkavacharana. Actually, when you see the treatment for melasma in Sushruta Kshudra Roga Chikitsa, that is what even Acharya Sushruta says, but there he says for Siravyadana, and because it is the phase where we don't generally dare to go for Siravyadana. Even I tried speaking with Shalyatantra people at my place, but they did not dare to go for Siravyadana. So what I did was we used to do scrubbing with Panchavalkala Churna, and it was followed by once in a 15 days Jalokavacharana. So there was very good results in most of the cases. I don't say all the cases, but yes, in most of the cases, I had very good results.
Ma'am, any internal medicine?
Internally, you can choose any of Pitta Shamaka and Rakta Prasadaka Dravyas, Mahamanjishtadi Kashaya, Aragvadadi Kashaya, or initial 1 month go for Aragvadadi Kashaya and then follow it up with Mahamanjishtadi Kashaya.
Thank you so much, ma'am.
Okay. I think somebody is asking about hair fall treatment. The hair fall treatment, again, first find out the reason why there is hair fall. So hair fall, is it because of any problem with the scalp? Then treat with that. If at all there is dandruff, then again check whether the dandruff is dry, powdery, or the dandruff is oily and flaky. Based on that, we can select the medications. Like you can see, Durdura Patradi Taila is the most commonly used oil with respect to dandruff. But most of the patients say their problem generally increases with Durdura Patradi Durdura Patradi Taila. So whenever there is dry powdery dandruff, do not use Durdura Patradi Taila. If it is only oily, scaly dandruff which is associated with hair fall, go for that. Otherwise, you can go with Chembaratyadi Taila. So if it is hair fall is because of scalp problem, this is how you can go with that. Or if it is because of any other systemic issues, like there is reduction in the iron content or reduction in the hemoglobin levels, then you have to go with that supplementation. And if it is also reduction in vitamin D levels, then you are supposed to supplement the individual with vitamin D, because vitamin D is very much necessary for our bone health, and we know Kesha is the mala of Asti. So that is why maintaining the health of Asti Dhatu is also very much important. Apart from that, generally you can also go for hair packs based on the condition. As I told you, if it is excessive oily hair, then use more amount of churnas in your hair pack, and do not use a hair pack more than 30 to 45 minutes. Okay. And make sure whenever you apply any sort of hair pack, you have to cover it with a shower cap. Do not leave it like that. Do not allow it for drying. If you allow it for drying, then hairs will become more brittle and there will be more hair fall. So you are supposed to cover it with the shower cap, and the same amount of wetness has to be seen even after 30 minutes, and rinse it off within or not more than 30 to 40 minutes. And if it is more dry and frizzy hair, then do not use more of the churnas. Go for the things like Japa Kusuma and Japa Kusuma Pushpa, Japa Kusuma Patra, Methi seeds, even Atasi Bija. Such kind of things can be the main ingredients if it is more of dry and frizzy hair scene. So this is how you can treat hair fall. Then, ma'am, which oil you told other than Durdura Patradi Taila for powdery dandruff? It is Chembaratyadi Taila, where again Japa is the main ingredient. Chembaratyadi Taila. Or Chemparutyadi Taila is also one more pronunciation. Please spell. Okay. Yeah, I think it's clear now.
जी मैम। पार्टिसिपेंट्स और कोई डाउट है तो बस लास्ट क्वेश्चन लेंगे।
Ma'am, will you share a contact number or in WhatsApp number? Like, if you have any query later.
जी थैंक यू सो मच मैम। बहुत ही इंटरेस्टिंग और बहुत ही नॉलेजेबल लेक्चर आपका रहा। इस ज्ञान रूपी यज्ञ में एक व्याख्यान रूपी आहुति के लिए आपका बहुत बहुत धन्यवाद। मैं हेतल मैम और बलदेव सर के बिहाफ पे आपका बहुत बहुत धन्यवाद एवं आभार व्यक्त करता हूँ। अब हम सब लोग शांति मंत्र का जाप करेंगे।
Before that, again, once again, I would like to thank Hetal ma'am and also Dr. Anil Kumar for coordinating this. And I'm very happy there were so many questions. It means that participants were definitely aware and they were listening to my presentations. I'm really happy with the question and answering section. Thank you.
जी मैम, बहुत ही अच्छा, बहुत ही उत्कृष्ट लेक्चर था। आपका एक बार फिर से बहुत बहुत धन्यवाद। अब हम सब लोग शांति मंत्र का जाप करेंगे। आप सब लोग अपना माइक म्यूट ही रखेंगे और म्यूट रख के ही दोहराएंगे। ओम सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति शांति। नमो नमः। विश्व मंगल की कामना के साथ आयुर्वेद को भारत की राष्ट्रीय चिकित्सा पद्धति घोषित करवाने हेतु विश्व आयुर्वेद परिषद की NIA शाखा द्वारा 21 नवंबर 2015 से अनवरत जारी इस साप्ताहिक व्याख्यान माला के अगले व्याख्यान के लिए और किन्हीं दूसरे वक्ता के साथ हम अब आपके सामने उपस्थित होंगे अगले शुक्रवार को। तब तक के लिए आप सभी को नमस्कार और आप सबका बहुत बहुत धन्यवाद। थैंक यू एंड ऑल।